Um, my name is Nishchit Baral, um, resident internal medicine, McLaren Flint, Michigan State University in first year. My presentation is on the topic brief psychotic disorder post COVID-19 and self quarantine, trying to answer the question: does social stigma and neglect post COVID-19 matter? We had a very interesting case. A 53-year-old African American gentleman with no any significant past medical history, no any psychiatric history, who presented to our hospital on 24th October 2020. Uh, he was tested positive for COVID-19 in an urgent care center. He had visited the center for fever, cough, and weakness for 2 days. His symptoms improved after 14 days of self quarantine. He was not treated with any medications. He returned back to the work after 14 days. After 5 weeks of COVID-19 diagnosis, he started to get delusional thoughts about people plotting to kill him. He thought his wife trying to kill him at home. This made him combative. His delusions and combativeness worsened with time, and his wife had to bring him to the hospital. Initially, he was in a nearby hospital where he left against medical advice. Again, the next day in December 14th, at around 1:34 a.m., he was brought to our hospital. In the ED, he was very delusional, so he had to be given haloperidol 5 milligrams, which calmed him down. I talked to his wife. She explained to me that he was a different man. He never had any psychiatric symptoms before, no any history of substance abuse, no any family history, no any recent stress regarding financial issues or any strain regarding the relationship. Our behavioral health and psychiatrist team, they provided us with the diagnosis of brief psychotic disorder. Um, um, After the diagnosis, he was admitted to our hospital. We are just managing him supportively, counseling him every day, and his symptoms slowly start to improve without any pharmacotherapies, but just with counseling. Um, and He was eventually discharged from our hospital, and we followed him in outpatient clinic in 7 days. Um, after 1 week, when he followed us in the outpatient clinic, we were surprised that his symptoms had been dropped. Um, it was really dramatic that his symptoms had improved to such an extent. His lab workup, all the investigations were normal initially. We had a lot of DDs in our mind, um, and but all of them were within normal limits. So we came to the conclusion that COVID-19, especially post COVID-19, and the social stigma can be a significant issue in patients with who are individually vulnerable, and they can get the infection and all the psychiatric symptoms. And we should be really careful in recognizing these patients. Um, while talking with him afterwards, we came to figure out that um, he was having a lot of delusional symptoms. Um, he had a lot of neglect at home. He was not treated well. He had even at his work, he was isolated from his work. He even though he was negative, he was um, facing a lot of stigma by the people that he's still positive or he can transmit the infection. So all these conditions had made him um, believe or develop these delusional symptoms. So I think we need further research in this question, and our case raised the questions that does social stigma and neglect really matter? Thank you so much.